How long is GERD surgery recovery? Imagine waking up after a surgery that could help you breathe easier and eat without discomfort. Now, let's talk about how long it really takes to get back on your feet after GERD surgery. Most people who have a procedure called Nissen fundoplication, where the top of the stomach is wrapped around the lower esophagus, usually stay in the hospital for 1 to 3 days if it's done laparoscopically. This minimally invasive approach means smaller cuts, less pain, and faster recovery. If open surgery is needed, the hospital stay might be longer, around 7 to 10 days. Once you're home, many patients feel strong enough to go back to work or their usual routines within 1 to 2 weeks if they had laparoscopic surgery. For jobs that aren't physically demanding, this is often enough time to heal. But if open surgery was performed, it could take 4 to 6 weeks before you're back to normal activities. Pain after surgery is usually mild to moderate. You might feel soreness around your abdomen or at the small incision sites. Some people also experience shoulder pain for a day or two because of the gas used during the procedure. This discomfort typically goes away on its own within a few days. Right after surgery, your diet will need to change. You'll start with liquids for about 1 to 3 weeks to help your esophagus heal and to reduce swelling. After that, you'll gradually add soft foods over the next 2 to 8 weeks. Swallowing might feel tight or difficult at first, but it improves as healing progresses. It's common to feel bloated, crampy, or gassy during recovery. These symptoms often improve within 2 to 3 months. You might notice your appetite is reduced initially, but it usually comes back as your stomach adjusts to the new shape. Many patients say their stomach feels smaller after surgery, making them feel full faster. This sensation usually gets better within 2 to 3 months as your stomach learns to work normally again. In summary, most people can get back to their daily routines within 1 to 2 weeks after laparoscopic GERD surgery. Full recovery, including dietary changes and feeling comfortable swallowing, can take several weeks to a few months. Open surgery requires a longer period, often 4 to 6 weeks or more. Remember, following your doctor's advice on diet and activity is key to a smooth recovery.